I am pleased to join this gathering of dedicated stakeholders in the Noma world at this international conference themed Noma, a neglected disease. Noma, also known as Cancrum oris, is still poorly understood and is a rapidly progressing necrotizing infection of the mouth and face with a high mortality rate, which can be within 2 weeks of onset if untreated. Noma occurs among 2 to 6 year olds, severely malnourished or immunocompromised children of poor, uneducated rural women in poor hygiene and sanitation settings. Most children who survive the disease retain severe facial disfigurements, which affect both speech and feeding abilities and the prospects of community acceptance. Noma is found in very low-income countries or such with extreme inequities, especially in sub-Saharan Africa, having been eliminated in higher-income countries. It can also be an indicator of worsening economic crisis in conflict settings during natural and man-made disasters, all of which are with deteriorating sanitation, declining nutritional status, or during incidents of disease outbreaks, such as the ongoing COVID-19 pandemic. All of these circumstances reduce access to quality nutrition and healthcare, adversely affecting health and well-being of children. Apart from the poor general health and premature death, Noma patients, who are mostly children and young adults, suffer from high levels of stigma and social exclusions in their communities, an experience which no child should be left to undergo. Nigeria is pursuing a number of initiatives to raise awareness of Noma in vulnerable communities. These are institutionalization of annual commemoration of the National Noma Day so that government and the political class are better informed about its gravity, given its rising prevalence. Sensitization of stakeholders on the need for quick, sustained action against the disease. Establishment of the National Noma Control Program with dedicated funding from the federal government and HIF's Action Noma EV through the World Health Organization. The priority target of this fund is to support disease prevention and capacity building of health workers on early detection and counseling on nutrition and hygiene, which have been done in several communities. Nigeria has also constituted a technical working group made up of renowned scientists and academics of repute to advise government on best ways to tackle Noma. This disease condition is preventable if modifiable risk factors such as malnutrition, poor hygiene, and lack of effective immunization services in certain remote communities were addressed. Government also uses a multisectoral approach to curtail effects of Noma through collaborations such as between the Noma Control Program and the National Orientation Agency to communicate social and behavior change through National Orientation Agency channels. With the National Primary Healthcare Development Agency to ensure that children are immunized against preventable diseases. With the Nigeria Center for Disease Control to ensure daily notification of this disease using the Integrated Disease Surveillance and Response System. I conclude by thanking organizers of this conference. I'm confident that groups gathered here will further define ways and means to address this disease. The political will to tackle Noma in Nigeria is strong, and we are ready to support Noma-related initiatives that can include resolutions reached at this conference. I thank you all for your attention.